Hi, I'm Dr. Jeffrey Antimarino from Blepharoplasty Surgery and Medi-Spa. Welcome to our live Facebook tonight. We're going to talk tonight about one of my favorite procedures to do, and that's eyelid surgery, also known as a blepharoplasty. So tonight, to help me go through that is our nurse injector, Pamela, who underwent the surgery about 2.5 months ago. And so she's going to be open for any types of questions that you might have, and we're going to go through the procedure and kind of explain all the nuances. So let's kick it off, and I just wanted to start it by asking Pamela what kind of brought her to that decision about an eyelid surgery versus anything else.
I believe the reason I chose to do the eyelid surgery is I was seeing some of the skin come down, and I was noticing it more and more. So knowing as the aging process and seeing in family members how that process works, that it was getting worse and worse each year. And I know from what I do, I can do fillers to create volume somewhere, but at that point, there's no place up here you can create volume to take care of that excess skin. So it was only going to get worse, so I chose to fix it now, and I'm very happy with the procedure.
Yeah, I think that's a lot of what a younger crowd is coming in for now. So years ago, we were doing eyelid surgery on patients that were really in their mid to later 60s. And now we're starting to see it in a younger crowd of even as early as late 40s. Pam is in 50, right? So, you know, but that's the common ages now. So patients that are really starting to see that in their mid 40s and on. The crowd that we're seeing it even earlier than in the early 40s are patients that really have a genetic predisposition to it. And as Pam was saying, she's seen from from family members how that aging process works in her family, and that usually is starting to bring people in earlier. And the good thing is with eyelid surgery, it's a long-lasting surgery, so getting it done in the early 50 range, the tissue is still very good. She has good tensile strength of the tissue. The skin is in good shape. So she'll actually get a much better result than if we had waited another 10 to 12 years. So I think that's what we're seeing now. So this procedure for me is increasing in popularity for both men and women, and doing it at a younger age, people are really starting to enjoy the results of this operation at a much earlier age. So when we talked about your surgery at the beginning, I have a pre-op photo of you, and I don't know if this is coming up, but most of what Pam was talking about is the excess skin up on the upper eyelid, and a lot of patients start to see that that's a sign where they're starting to look tired, and patients will come in saying, everybody keeps asking me if I'm tired or I'm overworked, and they're not. The other thing is she's just starting to see a little bit of excess skin, a little bit of that crepey skin on the lower eyelid, which again, a lot of patients will come in thinking that they look tired and that their eyes are not as large or as noticeable as they used to be. And I think that's what we talked about with you from the beginning.
Yes.
And then this is just a little bit more of a close-up so you can see it a little bit better. And so going through the process, kind of tell them we did it under IV sedation, so we did it
Yes.
under twilight.
It was a very easy procedure. Didn't take very long, very comfortable. We went into the surgery center and did our pre-op and marked me, and then all I remember is waking up. I did have a little bit of discomfort, like as waking up, like a burning sensation, but as soon as the nurse took care of that, from that point forward, I had no discomfort whatsoever. Had swelling for a few days. I used ice a lot the first 3 to 4 days, just for comfort measures and to get the swelling down. And ibuprofen, although you told me not to use too much if I was bruising, but I did not have a lot of bruising, so I chose to use a little ibuprofen and the ice, and maybe had swelling for the first, bad swelling for the first 2 days, but then after that it was pretty tolerable. And it was very comfortable.
Good.
It was an easy procedure.
A lot of patients will say the same thing, that there's not really a lot of pain associated with this procedure, and It's a very delicate procedure, which I really enjoy doing, and keeping somebody. Usually put a little bit of tape underneath the eyelid to support it for the first 5 to 7 days, and that kind of helps take away some of that swelling. On the upper eyelid, it's usually a single incision, and it's just up in the eyelid crease, and I have some stitches that I take out about 5 to 7 days after surgery. On the lower eyelid, patients, that's where I'll show you some photos, where patients have some bulging, and everybody knows somebody who has it, but it looks like they have some bulging or bags under their eyes. And that's just some fat that, as we get older, starts to kind of push through, or what we call herniate through, and now you can start seeing it. And to get to that, I actually make an incision on the inside of the eyelid through the mucosa, because the fat is sort of situated just in front of that. So you can actually make a little incision in the mucosa and take out, there's 3 fat pads that you can take out. And then you let the mucosa come back together, and you don't even put any stitches in that. It's like cutting the inside of your mouth, and in a few days that will just close and seal. And then once you take the fat out, then you can come in and just under the eyelashes, you can make an incision right under the eyelashes and extend it out just a little bit further. And with that, you can actually dissect the skin up a little bit and redrape it. So patients that come in and have some discoloration of the lower eyelid, especially in that trough right here, we call the tear trough. Some of that is shadowing because of the bulging, and some of it is just some discoloration. But that will definitely improve once you redrape redrape that skin and lay it out. The same kind of stitches I put on the upper eyelid, I put in the lower eyelid on the outside of the skin. I take those out in 7 days. So you can see the junction of the cheek and the eyelid now become much smoother. And it's a really subtle result, but it's one that many people that you'll come in contact with notice. They don't know what you did or what, that you're resting now. Most of them want to know if you're taking vitamins, if you're exercising, because they don't suspect any surgery, but they just know that you look more refreshed. And that's the great thing about the surgery.
I get a lot of questions. Did you do your makeup different? Did you get your eyebrows done? They can't figure it out. They just know by looking at me there's something different, and they can't figure it out.
Is this something that insurance covers?
Well, insurance companies may cover the upper eyelid only. They will not cover the lower eyelid. But so what we're looking for when patients come in is how much excess skin do they have on their upper eyelid. If the eyelid skin is actually enough that it's hanging either onto the eyelashes or at the tip of the eyelashes, then what I usually recommend is they see their optometrist or their ophthalmologist and get what's called a visual field test. So that test, you actually look into a device and they'll flash some lights, and it will actually measure how well you see the periphery or the outside part of your vision. If that is decreased, then we can, with photos and the results of that test, submit it to your insurance company for possible coverage by your insurance company. One thing that you have to do as the surgeon when you evaluate somebody is you have to make sure that the relationship of the eyebrow and the upper eyelid are so synonymous that you want to make sure that it's an eyelid problem and not an eyebrow problem, or both. And that is key. There's many times I have patients that come in and have had an eyelid surgery done somewhere, and now they're noticing that their brow is too low, and they want to do something about it. And then when I put the eyebrow in the right anatomical position, they won't be able to close their eyes because too much skin was taken. So you really, when I mark a patient, we mark where the eyebrow sits, and you can see with Pam, she has a perfect eyebrow. It's sitting above the rim of her orbit, so right above the bone. And so it's easy for her, it was easy for me to mark her. But some patients, if I may, some patients come in and that eyebrow is really down, and you can see just by doing that how it affects the eyelid. So it can make it look like your eyelid has too much skin. So to evaluate, you always want to put the eyebrow back where it's supposed to be, and then only the excess skin is what you take off.
Can you do just the upper eyelids or just the lower eyelids?
You can do, in this case, some patients through genetics develop way too much skin on the upper eyelids at an earlier age, and so they don't see as much aging in the lower eyelids, and so those patients are a good candidate for the upper eyelid surgery. Again, some patients have a component whereas the eyebrow is too low, or the eyebrow is low and they have too much skin. So you can actually do an endoscopic eyebrow lift and an upper lid surgery at the same time. You can do an eyebrow lift without the eyelid surgery if the eyebrow is the problem. So you really have to make sure you diagnose the problem and not just think it's excess skin. Some patients have equal aging of both the upper and the lower eyelid. On those patients, I would recommend they do the upper and lower together, because now, even though you don't like the fact that you have too much skin in the upper and lower eyelid, they're aging in balance, and so it's actually a better look than doing just the upper and leaving the lowers with some bulging or some excess skin. Because once you clean up the upper eyelid and you don't do the lower, it's going to make the lower look even worse. So I usually recommend that patients that have synonymous or symmetrical aging of the upper and lower eyelid to do them both at the same time.
Is there anything you recommend a patient do to prepare for eyelid surgery?
No, there's really nothing to prepare for. Most patients, we look at your past medical history, the medications that you take, the surgeries, how you did with anesthesia in the past. So we go through all that, making sure that you are a good candidate from a medical standpoint for surgery. But there's really no way to prepare. The only thing I would, again, recommend is that you have an examination with a plastic surgeon. And if you qualify, then it would be the visual field test would be the only thing that you would prepare for.
Is this procedure common for men?
It's becoming more and more common for men to do the surgery. I've seen over the last 7 or 8 years, liposuction used to be my most common procedure for men. And now it's sort of given way to chest surgery and facial rejuvenation. So I'm doing a lot more male facelifts and eyelid surgery. So what men are starting to find out is that even though they're working out and taking better care of themselves, you can't beat the aging process and you can't beat genetics. So, if you're in shape and you're able to run and lift and do all that stuff, but you start to get into that aging in your face and eyelids, it bothers a lot of guys, and they want it corrected.
Is there anything you would recommend, Pam, for someone who's considering it? Is there something that really pushed you towards that decision more?
I think a lot of people are concerned with the pain management of it, and I must say it was extremely easy. The recovery was easy. A little bit of swelling in the morning, less in the afternoon. Not a lot of strain on the eyes during that healing process, but it was extremely easy and painless, basically.
Are you still able to wear glasses if you wear glasses?
Yes, the only thing I don't let you use for the first couple of weeks is contacts, but you can wear your glasses right afterwards. And I think that's a big thing a lot of patients are worried about, is this going to affect my vision? Is it going to affect my dry eyes? It won't affect your vision. It won't change the dryness of your eyes. So sometimes patients will tell me right in the beginning that their vision actually is a little bit better, but as the swelling goes down, it usually returns just back to normal. So it doesn't change the shape of your eye. I think that's a big concern. Patients want to make sure that the shape of their eye isn't changed at all. And so we don't see that. You're going to go back to the same. If you use drops for dry eyes, you're going to go back to using them almost right away.
Were you able to wear makeup? How long did it take before you actually started wearing makeup again?
I was off 8 days, so for those 8 days I was just recuperating, and I didn't feel any need to wear makeup. The sutures come off after 5 days, and a lot of the swelling was down in about 10 to 12 days. I was pretty much looking normal. And I just slowly eased back into wearing a little bit of makeup after about 10 days.
Yeah. For most patients, I take like Pam was saying, I take out the stitches between 5 and 7 days. I usually have you wait about 24 to 48 hours afterwards, and then you can wear makeup. And if you get any bruising, it's usually from the lower eyelids, and it's usually pretty mild. And that usually takes about 10 to 12 days to go away almost completely.
You said you had other photos you wanted to talk about?
So this is a younger lady. So you can see this is her pre-op photos. You can see the excess skin in the upper eyelid, but notice the fullness of the lower eyelid. So she has that tear trough. she has this bulging, and it makes her, she has nice blue eyes, but it makes her eyes look more crowded. And so taking out that fat pad on the, going through the incision on the inside of the eyelid, and then making that incision just under the eyelashes and out, and this incision on the upper eyelid along the crease, and then this is her afterwards. So you can see it really does streamline the lower part of the lid. She doesn't have that bulging. She has a much more gentle transition between the cheek and the lower eyelid, and then the upper eyelid is much more open. And so there's one other one I wanted to show you. Another patient is kind of dark, but you can notice the severity of the bulging on the lower eyelids. And so again, for both men and women, that really makes everything look crowded. It makes your eyes look smaller. And then shortly after surgery, you can see how much more open the eyes look, and that nice gentle junction between the upper cheek and the lower eyelid. So the surgery itself is, can really give you that subtle change that lots of people will notice, but they're not looking for surgery. And at 2.5 months after surgery, it's hard to see where the incisions are for Pam. They really do just sort of melt away.
So what would be the downtime from work again if someone were to take time off from work?
Depending on how what your work schedule is like or what type of work that you do, if you're mostly working in an office, then I usually have patients kind of wait it out. I would say a good 1.5 to 2 weeks off. I've had some patients going back in 1 week after I take the stitches out, they wear glasses and they go back to work. Again, it's sedentary. And they weren't really worried about what other people thought about the incisions at that point because they're still a little pink at that time. Get back to exercise is about 3 weeks. If you have a physical job, then I would keep you out probably a good 3 weeks and let that swelling go down, because in that first 3 weeks, the swelling goes down relatively quickly. But if you do anything to get your heart rate up, or you strain, or you're overworking, you can really get that fullness back and that swelling, and then it's slower to resolve. And as Pam was saying, swelling of the face is always a little bit worse in the morning, and then as the day goes on, it gets better and better due to gravity. But where the rest of our body actually gets more swollen as the day goes on, the face is a little bit different. It's just the complete opposite. So most patients, when they get up in the morning, have a little bit more swelling, and then by the time they're going to work, it drains pretty well.
As an injector, Pam, is there anything that you could do if you weren't quite ready for eye surgery? Is there anything that you do to kind of manage the aging process until they actually move into the surgical realm?
I do get a lot of customers who come in with some bulgingness or bags under, and they think I can put filler in there to smooth that, but honestly that makes it worse. The hyaluronic acid derma fillers will draw water to it, make that puffiness underneath like he showed in the pictures. It'll just make it a lot worse. So that's why I always recommend to them not to even consider any derma fillers there. When it gets to the point that they want to have surgery, to go to see a plastic surgeon and get the surgery done. As far as above the eye, if anybody has excess there and they just want a brow lift or that lifted a little higher, and that's just part of the frontalis muscle, doing a little Botox there. We know how to bring it up a little bit, which is temporary for 3 months until it wears off. If they like it, they can keep doing it. But as the aging process goes, eventually it's going to get to the point that that's not going to be helpful for their vision.
Right. I think some people, there are patients that will have aging of their lower eyelids without much fat herniation, so you don't see those bulges, but they're starting to get the excess skin and that crepiness. So in that case, there's something you can do with a little bit of filler along the tear trough and kind of fill in that gap. But as soon as you start getting that bulging, as Pam said, you actually make it worse, because when you put the, in some of the pictures I showed you, you have that definite bulge, and then if you put the liner or the dermal filler below that, it actually makes the bulge look thicker and more pronounced, and it's the last thing you want to do at that point.
So what would be the first step if someone was interested in having their eyes done, what would you recommend they do?
I think the best thing to do is to see a plastic surgeon or an oculoplastic surgeon, and really have a good evaluation. Again, you want to have somebody who does a lot of eyelid surgery, because you want to have somebody that can discern between the level of the brow and the excess skin of the upper eyelid. You also want to assess how the upper eyelid moves, or what's called the excursion. Sometimes the eyelid itself can sag a little bit, and it has nothing to do with the excess skin. So you also have to, as the surgeon, you have to be able to assess that, because that might be something that needs to be fixed as well. And that's something that your insurance company might be prone to help pay for. And again, the lower eyelids can be tricky. Everybody thinks that the upper eyelid, because it moves, is very specialized, but the lower eyelid is extremely specialized, because if you just pull your eyelid away from your eye, it's irritating almost immediately, where your eye starts to feel very dry. So you want to have somebody who knows how to do that incision on the inside of the eye and the outside of the eye, because the risk of causing that deformity is very minimal, as long as someone knows how to do it. So I would really inquire about how often they do that surgery, how many years they've been in practice, even look to see some of the results that they have, or talk to some patients that have had it done by that surgeon. But I think it's something that it's worthwhile. But the first start is really just to go and see somebody, build a rapport, find out talk to them about what your complaints are, what you're noticing in the aging process, and then kind of hear what the game plan would be.
I would imagine, you mentioned photos and images, I would imagine because it's on your face and it's recognizable, that a lot of patients don't necessarily want their pictures taken and posted.
Right, and it is difficult. So just because the surgeon doesn't have a lot of those photos, it doesn't mean they don't do a lot of them. It just means that the patients are, again, it's identifiable. So what we try to do is do some more close-up shots, like some of the ones I showed you, and that would be what we would put on the website. But even then, some patients are reticent about putting them on or out in the public, and then it's completely understandable. But if they do have it, then it's something that you want to look at.
And you mentioned you have patients talk to someone that's looking at doing the surgery. You have patients that may talk to them directly rather than view photos.
Right, and that's always a good thing. And the nice thing is that Pam's been very open to talk to patients that are inquiring about it, and just giving her the honest, giving the honest of how she recovered. We try not to sort of lessen anything. I want everybody to have, realistically, when she says, I had a good 2 to 3 days of some good swelling, and then it started to go down, I had redness. I want patients to know that, because I want them to be able to plan for it. I think trying to talk somebody into surgery or camouflaging it so that it doesn't seem to be this, as much as it is, patients don't want to know that. They want to be able to plan, because they need to have time off of work, more time with the family. If there's an event coming up, you don't want to do this surgery, 2 weeks before a wedding. This is something you want to do with plenty of time. And so it helps patients plan and to see if they're even ready to do the surgery. So open and honest conversation with the patient who's undergone is the way to go. Okay. Well, listen, thank you so much, and thank you for listening. I hope this was educational and kind of give you some pointers if you're thinking about this, what to look for, also what to ask for when you're with a surgeon. Thank you again. Next month is October, which is Breast Cancer Awareness Month, and so we are going to be doing our live Facebook at the end of the month with our group of ladies that are at different stages through the diagnosis of breast cancer, some that have already had the surgeries and reconstruction, some that chose not to have reconstruction, patients that are undergoing chemotherapy. So please stay tuned next month. It's very special. We all know people that are going through a cancer of any type, but especially breast cancer. So feel free to call in and ask any questions that you have.
What website can they get information on?
So, www.bellissimoplasticsurgery.com. You can also follow us on Facebook and Instagram and Twitter. I always have to think through those. So thanks again, and we'll see you next month.